Okay, this is Jacob Nelson for Essay3, Exam3's Bio461 questions. So first we want to start off with describe the composition of blood. So blood is comprised of three main parts. That is plasma, white blood cells, and red blood cells. The plasma portion of blood is mainly comprised of water, but also has a ton of different things, such as proteins like albumin. Also contains hormones, like ions, other kinds of sediments like that. White blood cells and platelets are its own category, its own section within its composition. And then red blood cells is its own thing. For red blood cells, it contains, hemoglobin, which is what carries oxygen. And for men, the number of red blood cells, we like to I guess make a number called hematocrit, which is number of hemoglobin per total volume of blood. And for men, it's typically in a range between 45% to 55% of blood. And for women, it's 35% to 45%. So red blood cells, when they're created by bone marrow. Well, they're created within bone marrow. One option that I understand is that the kidneys secrete a hormone called EPO, which will go to the bones in our body with the bone marrow and stimulate those stem cells to create red blood cells. And those red blood cells, when they're created, only have a 120-day life cycle. Eventually, they're going to get broken down within either the liver or the spleen. How they get broken down is in different parts. Well, you start off with the hemoglobin. When you get rid of globin, that's basically amino acids, and you're just left with heme. Heme has the iron 2+ ion in it, which gives blood that red color. And I believe the heme is fat soluble, and it will be, once it gets near the end of its life cycle, it'll be located near the spleen. And when it gets caught in the spleen, it destroys the bonds holding the iron inside of heme. We call it heme oxygenase, and it gets converted to biliverdin or biliverdin, whichever way you say it. That becomes water soluble, and through a process of biliverdin reductase is the enzyme that breaks it down even further. It becomes bilirubin. I think bilirubin typically manifests itself as a brownish yellow color, and if that is left in the tissues of our body, that's what causes jaundice, that yellowing of the skin, or orangey color of the skin. And once it's broken down into bilirubin, it travels to the liver. And when it gets to the liver, it is conjugated, meaning it has a bunch of sugar molecules binding to it. And then it will try to leave the liver out through the bile duct into the intestine. It's used in its fat emulsification process of the GI digestive system. But anyways, the conjugated bilirubin will enter the intestine and it will become, I believe, is urobilin, And urobilin will do one of two things. It'll either enter the bloodstream that goes to the kidneys. When urobilin gets to the kidneys, it will turn into urine, and we excrete that out of our body. The other way is that urobilin will become stercobilin, which is dark brown in color and is excreted out of our bodies through the fecal route. Let's see. All right. We want to now talk about the 3 mechanisms that contribute to hemostasis, which is vasoconstriction, platelet aggregation, and coagulation. So whenever there is there's trauma to blood vessels, so let's say, you get stabbed and gets cut through the blood vessels. Well, the blood vessels has a layer of different layers of things. You have the basement membrane layer, and you have collagen layer. Well, if those are to be, broken, the body's way of protecting itself from bleeding out instantly is that it will vasoconstrict, making less blood flow through the body. And then what will happen is from the epithelial cells within the blood vessels will release von Willebrand factors that binds to platelets. Once it binds to these platelets, it'll activate it, and once it lands on these exposed collagen layers, will cause the platelets to have a conformational change, making these tiny little pieces of platelets into more like finger-like appendages coming from the platelet. And so when this happens, it can release different kinds of granules. You have dense granules, alpha granules, and this is meant to stimulate more platelets to recruit it for the platelet aggregation portion. It will release TXA, which is a thromboxane, which will should allow more fibrinogen receptors to be made to bind platelets to platelets together. And when a bunch of those platelets, so when a bunch of those platelets start binding to each other, it becomes this big old mass, and that is what we call the platelet plug. It's a very weak way to close the broken vessel. And so what we need is something more effective for the time being. And so we have the coagulation process. There's two pathways. There's an intrinsic pathway and an extrinsic pathway, which eventually come into a common pathway that stimulates the coagulation. And so this is done by creating fibrin that will wrap around these platelet plugs to better build a more strong foundation per se. Let's see. So let's just get into it. The intrinsic pathway is done more because it says intrinsically. We do it inside of the blood vessel. We have factor 12 binding to collagen. So let's say the inside of the cell, basement membrane layer is gone, but that collagen layer is still there. If it's exposed, that factor 12 can bind to it and activating it to activated factor 12. That activated factor 12 can then take in factor 11 and activate that. Factor 11 takes factor 9 and activates that. And activated factor 9 needs a cofactor, and that is going to be factor 8. So those two together will then allow factor 10. This is the beginning of the common pathway. factor 10 becomes activated, and that also has a cofactor, which is factor number 5. So you have activated 10 with 5. That will allow you to take factor 2, which we have the name for prothrombin, will become activated. So the activated 2 prothrombin just becomes thrombin. And that thrombin will take fibrinogen, which is factor 1, and activate it and becomes fibrin. So that is the intrinsic pathway, starting with factor 12 all the way down to the activated factor 1, which is fibrin, that we use to wrap around these platelets. Okay. One thing important to know about this is that there's a drug we use that can block this intrinsic pathway that is called heparin. And it only affects the factor 12 protein, which means only the intrinsic pathway is affected by this, because intrinsic pathways don't use factor 12. But let's get into it. Extrinsic pathways. So on the other side of this collagen layer, we have, other kinds of cells. We have muscle cells, fat cells, whatever, other kinds of cells, and they have its own factor protein. It's actually factor 3. So when that is exposed, then we have the beginning of the extrinsic pathway, where factor 7 is going to bind or be activated with factor 3 to become activated 7. And this activated 7 will then take on factor 10, activate that, and that whole common pathway, just like we mentioned in intrinsic pathway, will occur again. And then all the way down until you get fibrin, or activated factor 1. So this is the extrinsic pathway. There is a drug that we can use to also block this pathway instead of blocking the intrinsic pathway, that is known as Coumadin or warfarin. This blocks vitamin K activity in the liver, which stops the formation of factor 7, which is only used right at the beginning with factor 3 that was at the other side of the collagen layer. Okay, we also want to talk about one more thing. So we can use tests to determine if the effects of these drugs for intrinsic pathway or extrinsic pathways are being effective or not. For the extrinsic pathway, we have a PT test or prothrombin test. This is measured in INR in seconds. Whereas for the intrinsic pathway, we have a test called PTT, so 2 T's. This is postial thromboplastin test, measured in seconds. Sorry, give me 1 second. We also want to introduce one more thing. It's called TPA. TPA, plasminogen, and plasmin. So these are types of fibrinolysis. This is what will eventually break down that clotting we made, the coagulation we made from repairing the blood cell, because we don't really want that to stay there, because it could be dangerous, right? If you have a thrombosis or a blood clot break off and travel down the circulatory system, it can cause very bad consequences, right? So we have different kinds of fibrinolysis. We have TPA. TPA is a drug we can actually administer, and it will activate, so TPA, when it is used, it converts plasminogen, which is the inactive precursor, into plasmin. And that plasmin is a protease that will digest the fibrin that's using the coagulation, or wrapping around those platelets, right? And it'll lead to clot breakdown. Yeah, so this can help, administering TPA can help reduce the increased risk for thrombosis. Let's see. Yeah, and actually I think that's it. So thank you for listening. Like I said, this is Exam 3, Essay 3 for Bio461. My name is Jacob Nelson.